She leads a regional health insurance company from their headquarters in Grand Rapids, Michigan, to successfully compete against the national players in the same market. They also make time to deliver the wellness message through family events and bicycle races. Kimberly K. Horn, President and CEO of Priority Health, is this week's leader on leadership.
Knowing when to ask for help is critical when you're in a leadership position.
It's getting the best out of people. That's the essence of leadership.
Major funding for Leaders on Leadership is provided by Greenleaf Trust.
Helping people manage their wealth, accumulate assets, and preserve those assets for generational continuity implies trust. We are sitting down on the same side of the desk as you are. We're planning for your financial needs.
Additional funding provided by the Wayne State University School of Business Administration.
Welcome to Leaders on Leadership, here with a student audience at St. Andrews Hall on the campus of Wayne State University. I'm Larry Fobes. Since Kim assumed the lead at Priority Health, their customer base has quintupled to over 600,000, with annual revenues exceeding $1 billion. Impressive numbers for a one-state business. Thanks for being here, Kim.
Thank you for having me.
Now, your early career has always been in healthcare, but your early career was on the finance side.
Right.
When you were doing university work back at University of Michigan in hometown Flint, were you the quant expert on the study teams, or did you lead the study team?
I love the study teams.
So you were a leader even in university. You kind of like to take charge of things?
I think naturally certain people do kind of lead, but I've always been very analytical. I think that's a great background for business and certainly has served me well.
So you graduated, then you went off and you said your early part of your career was almost all financial. Mm-hmm. And it was also always in healthcare. Was healthcare the career plan, or is that just stuff that happened where the first job offer came from?
Actually, it was the first. I've always been in healthcare. It started actually in a sort of a happenstance in high school where I started working for a physician, and that's how my healthcare career started. And I worked my way through college in finance of a local hospital. And so my first job was as chief financial officer. So I've grown up in healthcare and it's my passion.
But it happened by coincidence, not necessarily when you were 6 years old you wanted to be in healthcare.
No, I don't think I had those sorts of aspirations. I would say one of my first jobs, the notion of being able to combine business with people and doing good, that kind of passion. So maybe that wasn't happenstance, but no, I didn't grow up thinking I was going to be in healthcare.
Then in 1988, you joined Mercy Health Plan,
right,
doing business as Care Choices, hired in as a CFO,
right,
but then transitioned to the COO, right, operations officer. A lot of people say financial jobs are analytical and technical and kind of buttoned down, and operations jobs are chaotic. How did you manage to change between the two?
Let's see. Well, first of all, in finance, I think the thing you learn, or I learned early on, is that's just the numbers, right? So the decisions that go into the numbers are most critical, and at least for me, it was around the notion of being able to lead and inspire people. That kind of got me interested in kind of an operation role. Plus, I was just interested in kind of moving up in my career. So it was kind of a natural transition.
And so you didn't mind the chaos of being operations officer?
Oh, I think if you're a chief financial officer, that's chaos.
That's chaos too?
That's probably the hardest job in most businesses, is the finance officer.
Because?
Well, you're expected to kind of look forward and backwards. Many of the decisions you don't actually hold. You're trying to influence people. Most businesses, it's very stressful. You're always the deliverer of both good and bad messages. So, and many cases I always tell our chief financial officer he has the toughest job in the organization.
Now, you joined Priority Health in 1997.
Yes.
as president and CEO. Now, we're still a relatively young company in those days. How did the company get started?
The company got started, actually, we'll celebrate our 25th anniversary this next year. We started in Grand Rapids, Michigan with a hospital, Butterworth, and their local physicians with the spurring on of local businesses. We were created out of the outgrowth of the first really health reform bills, and that came out of the Nixon administration. So out of some grant money, but it was all around this notion of we can improve the health of populations by influencing the way care is given. So 25 years ago, and yes, I started January 1st, actually, of 1997, the first day of the year, and it was a really fun company to join. Young, relatively small, enormous amount of energy and creativity, because it was really a company that had been started from scratch with a dream, and so it's been an amazing group of people, and I'd like to say we've done some great things.
And the dream was?
The dream was that we would have a significant impact on being able to ensure that everyone had coverage, healthcare coverage. That was the dream. And the only way you could do that, and we knew it, and we still do today, is that you have to change the way healthcare is delivered, make it more affordable, and improve the health of communities.
You sound like a lot like a congressional committee report I read last week. Now, fast forward today.
Right.
Tell us about the company today, its size, its scope, what it is, what it does, how it does it.
Well, we're a Michigan-based company. We're headquartered in Grand Rapids. We provide coverage of about 65 out of 68 counties in Michigan. We actually provide coverage to about 15,000 businesses throughout Michigan. We cover Medicaid. We're we have public-private partnerships in Medicare and Medicaid. About 1,000 employees. We actually insure people now in almost, I believe, all 50 states in the country. So it's a pretty significant operation and one that we're really proud of.
And that's a lot of growth in 25 years.
Yeah, from nothing to, actually our revenues this year will be about $2.2 billion.
Okay. Dramatic growth.
Yeah.
Now, a lot of the growth that's happened over this 25 years has been through merger and acquisition activity. When the company buys or merges with another company, how do you lead so that you're able to take the best of both operations but keep a consistent priority health culture?
Mm-hmm. Well, actually, it was pretty early on in my career at Priority Health, and one of our physicians actually that sat on our board made this point as we were looking at acquisitions, that don't overlook the culture and the compatibility of people within an organization, and we really took that to heart. So the first thing you have to do is most companies, well, any company for that matter, that employees have been there for a long time have a significant amount of pride, right? And they've done a lot of great things. And so we've always, when we've approached acquisitions, tried to, first of all, admit that we bought the company for a reason, right? There was some value both either in the people or the business, and to be very mindful of the pride and keep the best of both. And quite frankly, we haven't kept a consistent culture, that we have evolved, through the best thing of acquisitions are the coming together of different people, different styles, different ideas, and that sort of thing. So I'd like to say we kept the best of what we've always had from the beginning, but hopefully we've adapted and grew the culture to be different based upon where we're trying to go.
Now, we've all had favorite retailers or favorite restaurants or favorite service providers that we use.
Right.
And then sometimes they get bought by new owners, and the old customers say it's not like the old days.
Right.
When you merge or purchase another company, how do you manage that process so that the old customer base stays with Priority and doesn't go looking for better old days?
Well, one of the beauties about being a Michigan-based company and the acquisitions that we've done is we try to make it really, first of all, pretty personal. We try to understand from the very beginning why customers selected the company that we've acquired, and we really have a plan before we even go in. How we're going to make this better for the people who are spending their own money for the service. So first of all, very personal. Before we start actively trying to expand the business, we build a reputation, try to gain satisfaction, gain a reputation. But you have to add value when you go through these things. So if it's a takeaway, you're probably not going to succeed. So very clearly on, what is it that we're going to be able to do that's better because, of what we bring to the table. So we really do spend an awful lot of time on what's the added value and making sure that we're meeting the needs of the former customers.
Now, you've expanded recently into this side of the state, Southeast Michigan, through the purchase of Care Choices.
Right.
Your former employer.
Right.
It's got to be interesting.
Right.
Now, do you think, now that you're working on the east side of the state with your headquarters in the west side, do you lose the home team advantage? How do you manage that from a distance differently than you do at home?
Well, first of all, it's not very far. I mean, it's all Michigan. And so we compete, largely with huge companies. So our home time, a couple hours is still a home time advantage that we have. First of all, there's not a lot of difference between the west and the east. Side of the state, we're part of the same state, and so it's really not that far. So I still think we have the hometown advantage.
Okay. Now, you've got some interesting competitive issues to deal with as CEO. In the Michigan market,
Right.
You are a Michigan-based company and you're a one-state company. You basically work in Michigan. But you have to compete with national players who do business here or affiliates of national associations who have pretty commanding market presence. How do you lead the smaller company to effectively compete with the giants who have the deep pockets, deep resources?
I always say that we're probably the best of both worlds. We're just large enough that we have incredible talent. We're able to recruit great people. We have technology and infrastructure that is, first of all, doesn't have a lot of legacy because we're only 25 years old. So we're very nimble in that respect. We're just large enough to do some of the things that most small companies can't, but we're not so large that we can't move on a dime, that we can't get 1,000. It's much easier to get 1,000 people rallied around an idea, a concept, a direction than it is 20 or 30 or 40,000 employees. So we really try to use that advantage of being small but large, and I think it's really served us well. We're a very innovative company. We've been, for the last 25 years, pretty nationally recognized for some of the health solutions. But again, we're not so large to be as bureaucratic, or we don't have a lot of legacy technology, infrastructure, business practices that we have to overcome.
So sometimes it helps to be a little bit
I
smaller,
think so.
a little bit more nimble.
The best ideas come out of small companies, right? Innovation comes out of small companies, and that's the advantage that we have.
Now, one of the, as I studied for this interview, one of the things people talked about, you're able to fairly consistently compete on price. That you come in with a little bit better value for customers. I guess I assume that care deliverers charge about the same for everybody. How can you create a better price for your consumers?
There's in any business there's the price of your product, what you pay for components, but it's the production, all right? It's how you actually produce your product. We work on the notion of avoidable care. So the way that we deliver an excellent product, and a product that's more affordable than others, is working on chronic disease management, avoiding readmissions after congestive heart failure. So we work on trying to make sure that the healthcare is efficient and effective, and in the end, hopefully we all have a pretty, the input price is the same. It's what you do on, with the goods itself.
So it's the internal process,
yes.
Not just beating the hospitals up for better prices.
No, that in the long run, we are never going to win on that. We live here, right? Our kids will live here. We want to stay here. I think the great thing that we have are great health systems across the state, and it's to our interest to make sure that providers are successful. We're interested in building the infrastructure of our delivery systems, not beating them up. That is the unique thing about our organization, is we grew up, or we're part of a health system, so we understand the way that care is delivered. We understand the challenges that health systems, which are enormous, have, and we understand the issues that businesses have in trying to provide coverage to their employees. So it's the marrying of those two elements, the challenges of both sides, that is where we really focus our time.
So being owned by healthcare delivery, or 3 healthcare delivery systems, is a good thing. It's not a disadvantage, it's an advantage for you.
Oh, I think it's an advantage, and we call it, it's an advantage in terms of our DNA. You know, we understand how health systems work, how they're delivered, what their challenges are, so that's the advantage. And we also, we're interested in the same things. You know, health systems are interested in providing great care, right? Doing good for their communities, and that's exactly what we're working for. So we're compatible in that regard.
Thanks for being here, Kim.
Yeah, thanks.
We're going to take a quick break, but when we return, we'll talk with Kim Horn about leading Priority Health into the still undefined future of American healthcare. Welcome back to Leaders on Leadership. Joining us today is Kim Horn, President and CEO of Priority Health. Now, you're the CEO of a health insurance company,
Right.
but there are CEOs around the state who run companies who purchase health benefits for their employees. What insights do you have for them on how they lead their companies through this thicket of the changing healthcare system in America?
Well, the first, we're in the job of servicing those businesses, right? So the first thing that we keep in mind as we go about this is that this is not the business. The business of healthcare is not what our customers are in the business of doing. They're out creating jobs and goods and services in other regards. So it's our job to make it easier for them to be able to navigate it. So as an organization, we're trying to stay in front of the changes that are taking place, which you can't really predict, right? You can't predict what's going to come out of Washington exactly, what the rules and regulations are. But the one thing we can predict is that healthcare is increasing the cost faster than any other sector of the economy. We have to do something about that. We know that we're aging as a population, and we know that chronic disease is on the rise. So what we're trying to stay up in front of is creating solutions in that regard.
But you've got to, as a CEO of a health insurance company,
Right.
You've got to create, you want to keep your growth going, you want to
Right.
keep profitability, all the great things that are
Right.
happening, but you don't know what the health system's going to be either. How do you design a health insurance company for 20 years from now when you don't know what 20 years from now looks like?
You don't know what it's exactly going to look like, and that's why you got to make sure you stay adaptable, right? The thing that we try to strive within our organization is this is all about change. So to the extent that we, first of all, understand, we do know what the healthcare system is going to look like in the future, right? We're still going to be caring for people, right? We know that our system is very fragmented, and we need to make it more cohesive and structured, whether that be through technology or the development of group practices or integrated delivery systems. We know that has to happen. We don't exactly know how people will be accessing coverage or how they're going to be paying for it, but it really doesn't matter. You know, we're here to serve people. We're here to solve problems that all are around health. So, you know, actually we've developed a 5-year plan. And interestingly enough, 5 years ago when we developed this plan, we predicted many of the things that are coming to pass. Maybe not precisely as they're written, but we knew that there would be healthcare reform, right? We knew that there'd be pressure on you know, economic challenges. We knew that primary care would be at a shortage, and we needed to do something about that. So I think you can predict, and you know, what solutions you'll have to create, and you need to create an adaptable environment to make sure you're responsive to your customers and the economy around you.
Back to that smaller is
Right.
sometimes better
Yeah.
than being bigger. Now, you did an interview not too long ago, and you talked about one of the things you were most especially proud of was the early focus on primary care and the financial incentives for quality care. How does that work?
We actually started about 15 years ago, actually. There's a great person at our organization, Dr. Jim Byrne, who's been a leader in this regard nationally. And we knew, or we've always known, that we're going to have a primary care shortage in this country. You know, the students at Wayne State, if they're medical students, they're probably not thinking primary care for a whole lot of reasons. So as an organization, we can all do our small part, and we went about, first and foremost, on trying to make it easier to practice family practice or internal medicine, creating economic incentives so you'd want to go into the business, And if you do the right things for patients like prevention, chronic disease management, being accountable for that you should be rewarded. So we have the first pay-for-performance program in the country that was focused around primary care, and it started about 15 years ago.
But if they're doing the best possible care for the customers, doesn't that increase the cost, which goes against your bottom line?
No, not actually. It doesn't. If you practice evidence-based medicine and you're managing chronic disease, you have less readmissions or admissions. You have less visits to specialists, less complications. So you could spend a whole lot more on primary care if, in fact, it's done effectively.
Now, there's a lot of information and discussion out there in the literature about medical ethics. Mm-hmm. If I'm very ill, I want every possible treatment. I don't care if it's a high guarantee Absolutely. Of success or not. You want to give the best possible care, but you've also got to operate a business. How do you lead the company to find the right balance or decide where that balance is?
That's a great question, and actually it's something that our company has studied for a couple decades about this ethics in medicine, and we spend a lot of time at this. First and foremost, the decisions about medical care between a patient, their family, and their physician, right? And our job is to make sure that all parties have as much information about the decisions that they're making so that they make the best decision for themselves. I have a bias, obviously. We're a not-for-profit organization, and so we don't have the same challenges that some organizations have about short-term decision-making. I believe if we make the best decisions or allow people to make the best decisions about their medical care, that will benefit in terms of reputation and other sorts of things. So we never try to interfere in the decisions relative to treatment options. But more, it's our job to make sure people are making the best decisions. And so, that's a really delicate issue, but remember, if you make the decisions for your customers that you would want to be made for yourself or your family, you'll do the right things will happen.
In the same article that we talked about a moment ago, you made the statement that with the downturn in the economy and all the changes happening in the healthcare system, that it forces you, it reminds you to keep focused on patient care, what you were just talking about, and keep focused on having the long-term vision, not worrying about tomorrow. You said CEOs who don't do that face consequences. What consequences?
Well, you can do, first of all, you got to worry about today, right? Today's performance is really, really important, so I don't want to ever minimize that. But the one thing I learned very early on in my career, so I advise everyone early in their career, learn from every mistake you've ever made. If you only focus on today, you can make some really smart short-term decisions, but then you end up not being able to celebrate your company's anniversary for 10, 20, 30 years. We've always been about developing a legacy, so keeping the long haul. So, it is a delicate balance, but one of the things that I've always tried to do is make sure that you make every decision today in the context of tomorrow. What problem am I solving today, and what kind of a foundation will that build or develop for 5 and 10 years from now?
What's going to be the one big change in the healthcare system for the person sitting in your chair 25 years from now?
One big change, someone sitting in my chair. Well, hopefully the person sitting in my chair will be, have $15 or $20 billion and will be influencing public policy versus reacting to public policy. So I'm hoping the person in my chair actually has a really strong legacy and can be a very significant voice in healthcare policy of the future.
Okay, Kim, I've got one last question.
Okay.
You're working to lead a relatively small company against some of the big giants out there in the industry in your state. Let's put you in the same situation in a completely different sector. Let's assume, just hypothetically, you go back to hometown Flint, you're now mayor. How are you going to lead that city to retain and create and capture jobs and economic growth against all the offerings from all the other countries around the world?
You have to focus on innovation, right, and pride and reinvestment in communities. One of the things that I think is just remarkable from my current hometown of Grand Rapids is what the founders of that city have done, right? It's their home. They have encouraged others to invest and build, to create an environment that is not all about jobs, but it's a great place to live and work and raise a family. So I think you have to, just like in business, just like in your family, just like in cities, you have to focus on the basics.
Thanks for being here, Kim.
All right, thanks.
Please join us again next time for another edition of Leaders on Leadership. See you then.
Major funding for Leaders on Leadership is provided by Greenleaf Trust.
Helping people manage their wealth, accumulate assets, and preserve those assets for generational continuity implies trust. We are sitting down on the same side of the desk as you are. We're planning for your financial needs.
Additional funding provided by the Wayne State University School of Business Administration.
An encore presentation of Leaders on Leadership is available on demand for viewing at DetroitPublicTV.org.